Hi, I'm Dr. Asghar Husain, orthopedic surgeon. Today's quick question. If I hurt myself, should I go to the emergency room? The answer is maybe. Let me tell you why. If you're on a soccer field and you twist your ankle and you get some pain, you inevitably think, all right, I need someone to look at this right away. Well, the problem is if the person who is seeing you is not going to see you all the way through, then ultimately they may give you advice, which I hear a lot, which is just rest, lay in bed, elevate it, and ultimately that doesn't really serve you going back to what you want to get back to, because you come in with this idea that you need to be resting for 2 weeks, 3 weeks, 4 weeks, and ultimately you've gotten yourself behind. On the other hand, if you're in a car accident and you have a lot of issues, you absolutely should be going to the emergency room. Anyone who goes to the emergency room sees how crazy crowded things are. But generally what I've found is when it comes to mild, medium, intermediate kind of level injuries, where let's just say your pain maybe 2 to 3 out of 10 or so, I have not found urgent cares and ERs to really give useful advice as far as how you get back to where you want to get back to. So my answer really is, if you're trying to get advice to get back to function, you won't really find that in most situations at an urgent care or emergency room. Also, I want to give a qualifier. This is not medical advice. I'm not telling you whether you should or whether you shouldn't. I'm simply seeing the system is flooded. And I don't want to make this into a rant, but when I talk to emergency room physicians, it is flooded by people who've been told by their primary doctors or by their family members, you need to go to the ER. We don't have time to see you. I can't get into somebody. I've heard all of these issues brought up as reasons people show up in an ER. So number one, it may be that you're not going to get useful advice that will get you where you want to get to. And then number two, you're actually clogging the system and you're making it harder for the healthcare providers in the emergency room or in urgent care to help people who may really need it.
Okay, so specifically if we're speaking about orthopedics, we're talking about joints, like a joint issue. Let's say you messed up your shoulder, your knee, whatever. So if you're in pain, they give people some kind of idea, like what would be something like definitely I got to call ER, or something where maybe I should just talk to an orthopedic, make an appointment. So what really is some way to differentiate this? Most people, they freak out, they get a pain, like I had pain in my knee, because I have an HMO, but the first thing they always tell you, if you have any pain, you have anything, go to urgent care, go to ER. It's the first thing they always tell you on the phone. So I went to urgent care, I had pain in my knee, it was swollen, and they told me it was bursitis, because of course they don't have an orthopedic there at that time. There was no, they had someone just look at it. They told me it was bursitis. They looked at an x-ray, they said the x-ray is fine. So the pain keeps going. This is like weeks going by, and finally went to an orthopedic, and they said, no, you got a torn meniscus.
Well, look, I get why people do that. They're scared, they think they're going to hurt it, it's hurting a lot, and I don't want to give medical advice. Ultimately, medical advice should come from a medical practitioner. So if somebody is really concerned, they should see someone. Now, here's the interesting thing. As I said at the beginning, what I have found is that the most useful advice is from someone who has experience in musculoskeletal problems and can take you from the beginning to the end. And that doesn't necessarily have to be a physician, because what I find is if you go to an urgent care, what they typically will do is they will do something that's going to make you comfortable. And I often say comfort and function are different directions. So if your goal is to get back to your function, if you're a soccer player, you want to get back to playing soccer, if you go to an urgent care, what I often see is someone just says, well, hey, I took an x-ray, the x-ray didn't show anything, you're fine. So I always tell people, look, when in doubt, examine the patient. And if you're not comfortable examining these type of problems, then ultimately you need to punt to someone who can. But the problem really is in between that. There's this period of time where often people are shut down by the time they'll get to me or to another orthopedic surgeon, and that in and of itself causes other issues. So my concern with urgent cares is the advice that they give is typically not useful and sometimes even counterproductive. Again, I'm not trying to bag on urgent cares or get anybody to be upset. I'm simply telling you what I see. Is the advice that I see in urgent cares is typically not useful.
Well, because realistically, you're not going to see a specialist in your exact problem.
That's right. So typically, look, I'm not telling someone you should or you shouldn't. If you feel like you should, go. What I am saying is if your pain is tolerable to moderate, light to medium, maybe 3 out of 10 or below, you're moving the part.
There's no blood, there's no broken bones.
You're not seeing anything out of place.
Right.
I think an ideal situation is find your way to a healthcare provider. Again, you notice I'm not necessarily saying physician. There are a lot of very competent therapists and trainers and physicians as well who can really help guide you as far as where you need to get to. Because if your point is to get back to your life, to try to get back to your function, the delay in getting there, if you're just sitting around not doing anything, can be problematic as far as getting you back to function.
Okay, great. And once again, we're just talking about, or joint pain, like something happened to, like,
Exactly.
We're not talking about you're having a heart attack.
That's right.
Or, that's not what we're
Orthopedic
talking-
stuff only.
Right, that's what we're talking about.
I'm not saying go to the ER.
Okay.